Want to learn the management of anaphylactic shock in under 2 minutes? Then pay close attention. One of the most important signs you may have only seconds to recognize is angioedema. Notice these swollen lips and this swollen tongue here. If you see the patient closing their throat like this, trying to tell you they're choking, it's a major red flag. Angioedema can rapidly progress to laryngeal edema and complete airway obstruction. Also, look at these hives appearing all over the face, trunk, and limbs. This is one of the earliest signs. Remember, it's called anaphylactic shock for a reason. That's why we see this severe drop in blood pressure right here. If this post is helping you so far, make sure to like and subscribe so you don't miss the next video from DisneyMed. Now let's talk about gold standard treatment. We've placed this oxygen mask here because oxygen therapy is a critical first step. But the single most important treatment is epinephrine. Use epinephrine 1 to 1000 given intramuscularly at a dose of 3/10 to 5/10 milligrams. And yes, it can be repeated every 5 minutes if needed. Since the patient is in shock, fluid resuscitation is also essential. We've also added a salbutamol inhaler and an oxygen mask here to show that nebulized salbutamol is an important treatment for bronchospasm. To treat the angioedema, we administer methylprednisolone. But remember this important point. Aminophylline no longer has a role in the treatment of anaphylaxis, so I'm putting a big red cross over it to remind you not to use it. In fact, it can worsen hypotension and make the situation even more dangerous.